Hi everyone. Today we're going to be talking about breast MRI. So an MRI scan of the breast is a highly sensitive, non-invasive imaging tool which is very helpful for detecting abnormalities in the breast which may not be seen with a mammogram or ultrasound. Importantly, it does not replace having a mammogram done, but is rather used as a supplemental tool for imaging women who are at a high risk for developing breast cancer. The most common indications for performing a breast MRI include screening patients with a strong family history of breast cancer or certain genetic mutations, imaging newly diagnosed cancer patients to assess the amount of disease in the breast, and for those cancer patients who are receiving neoadjuvant treatment prior to surgery, an MRI is the best tool we have for assessing response to treatment. Typically, a breast MRI exam takes about 30 to 45 minutes to perform. It is an outpatient scan. Patients lie face down on a padded table, and contrast is injected through an IV line in the arm. This contrast injection is essential in helping the radiologist differentiate normal from abnormal tissue. 3D pictures of the breast tissue are then obtained, and once the scan is complete, the images are analyzed by a breast radiologist who will send a detailed report to the referring clinician. At Smit and Partners, breast MRI scans are performed at our Westville Hospital branch. For more information, don't hesitate to reach out to your radiologist or healthcare provider.